Rangi ki te whenua, whenua ki te rangi. Te ma whenua nei o Aotearoa, me te mana whenua. Aki, tiri tiria, tēnā koutou, tēnā koutou, tēnā koutou katoa. Ko Nicolette Sheridan aho noa, Ngāpuhi, te hekatū, te mahurihuri, Ngāti Paku, Ngāti Rawawe. Ko o te rangatira, o te kura nehi o te kunenga ki Purihuroa. Tēnā koe, Andrea.
Ko Andrea Donaldson aho, no Ngāti Maniapoto, ko o te pauako o te kuninga ki Puriroa. Kia ora.
Nō reira, tēnā koutou, tēnā koutou katoa. It is my great pleasure to celebrate this International Nurses Day with you on behalf of the Council of Deans of Nursing and Midwifery, Australia and New Zealand. The Council of Deans is the peak organisation that represents the deans and heads of schools of nursing and midwifery in universities that offer undergraduate and postgraduate programs in nursing and midwifery throughout Australia and Aotearoa. My name is Nicolette Sheridan. I have tribal affiliations to Ngāpuhi. I'm a member of the Council of Deans and Professor and Head of School of Nursing at Massey University in Aotearoa. The International Nurses Day theme for 2023 is Our Nurses, Our Future. Joining this global campaign, we will address the impact of the COVID-19 pandemic on the work of frontline nurses and other workers who seek to provide culturally safe clinical care to those at risk of harm from violence. Within this context, we'll talk about preparing frontline nurses and others to recognise and respond to non-fatal strangulation and mitigate future harm. Nurses leading interventions to prevent harm from violence can improve the care of those at risk of violence, which is a growing public health problem. It is my great pleasure to introduce our guest speaker, Dr Andrea Donaldson, who I'll be interviewing today. Andrea has tribal affiliations to Ngāti Maniapoto and is a registered nurse with a PhD in biochemistry and forensic science. She is a senior lecturer and an emerging researcher in the specialisation of mental health and addictions at Massey University in Aotearoa. Andrea's research on non-fatal strangulation and health consequences seeks to inform the response of nurses and those working on the front line to individuals and their whānau affected by violence. My first question, Andrea, what does mental health nursing have to do with intimate partner violence and homicide?
Thank you, Nicolette. Intimate partner violence and homicide is common. Those who experience abuse are twice as likely to need health services compared to a person not exposed to abuse. Women who experience physical violence from a partner are more likely to have accessed healthcare within the previous 12 months. They're more than twice as likely to have been hospitalised and to have reported emotional distress. 1 in 5 women who experience intimate partner violence threaten or attempt suicide in their lifetime. And it's been suggested that as many as 75% of homicide-suicides are related to intimate partner violence. Nurses, and in particular mental health nurses, are often at the forefront of care for people who suffer from the consequences of violence, such as PTSD, anxiety, depression, and suicidality. Nurses have a central role in communicating and supporting that change. By taking action that are evidence-based, nurses are able to be effective and mitigate the harm or even prevent harm from continuing in situations where there is intimate partner violence.
Andrea, what is the ongoing impact of the COVID-19 pandemic?
Violence against women and children has intensified since the COVID-19 outbreak. Financial hardship, isolation, increased opportunity for exploitation and abuse online with fewer external support services are all factors that have likely to have had an impact. So much so that the term shadow pandemic has been used to describe the increase in this violence. For many people, there will be longer-term mental health consequences, such as post-traumatic stress disorder, anxiety, substance misuse, and suicide. And there will be difficulties in accessing support.
Your recent work in the specialty of mental health nursing has focused on frontline nurses and health workers' recognition and responses to non-fatal strangulation. How common is non-fatal strangulation?
1 in 3 New Zealand women will experience intimate partner violence across their lifetime. If you're Māori, that rate is higher, where it affects 1 in 2 women. The estimates of strangulation in an intimate partner relationship are as high as 68%. In New Zealand, 5 people a day on average are charged with strangulation. So this is a big problem. Strangulation is very common.
Why is it important work for nurses, and especially mental health nurses, to lead change in clinical assessment?
All nurses should be aware of non-fatal strangulation. People who experience strangulation may present at a refuge or a welfare service without any clinical gaze, and they commonly don't get assessed. Frontline nurses in primary health care are well placed to be able to initiate early referral and intervention, but they also need to have community relationships so that they are the health worker that is contacted. Mental health nurses see people every day who are struggling, traumatised, stigmatised. As a mental health nurse, I deal with people who are at their lowest, and like other nurses, are in a position to support people in times of crisis. I've seen firsthand the long-term consequences of trauma and violence on our communities. Mental health nurses are skilled at assessment. We complete risk assessments, we complete safety plans, we provide education to whānau and to the community, so it makes sense that we are the people to lead, to assess, and to share information about the consequences of violence, raising awareness within multidisciplinary health teams about the early recognition and treatment of non-fatal strangulation is our work.
If nurses do not recognise and respond to non-fatal strangulation, what are the consequences?
In most situations, nurses and other health professionals have not had the training to identify signs and symptoms of strangulation and to provide the right treatment. A person who has been strangled has 7 times a greater risk of dying from violence in the future. Traumatic brain injuries caused by lack of oxygen or blood flow cause strokes, behavioural changes such as memory loss, confusion, headache, seizures, vision and hearing changes, as well as mental health problems such as PTSD, depression and suicidality. These are just some of the health problems that can occur. These health complications can be prevented or mitigated if nurses are able to recognise, screen for and respond to the early signs and symptoms. It is vital to changing health outcomes. Strangulation can be normalised in a violent relationship or in a sexual relationship. Nurses sometimes ask about strangulation in a situation where there is family violence. They don't usually ask about strangulation in a sexual relationship. They don't ask about strangulation in combat sports such as martial arts. The consequences, though, are the same. It doesn't matter how that strangulation is occurring.
Andrea, how do you look after yourself?
This is really challenging work, and some people's stories can be really heartbreaking. Some literature that I've read can be difficult and distressing. But my job is also really rewarding, and it's a privilege to be able to support people during some very vulnerable and distressing moments in their life. However, to enable me not to be traumatized or not to develop compassion fatigue, I spend time with my family where the phones and computers are off, so that I'm not thinking about work. Peer support and debriefing is really important. I do this with a colleague that I trust. This supervision has both a clinical and a cultural focus. These are some of the things that Professor Kim Foster discusses in her research on resilience. She talks about the importance of collegial support networks to prevent trauma and burnout. I also eat well, I get enough sleep, and I do exercise, but it's not always achievable, but I try. I book my annual leave early for the year. Sometimes I need to change dates, but it's just a reminder to me to take leave so that I can recharge. I think that if you look after yourself, you're in a better position to look after others.
So what should nurses know to be clinically and culturally safe in their work to prevent harm from violence?
Nurses need to know that strangulation is common, that it occurs everywhere, not just when there's violence within a family. Pornography often includes strangulation, as usual, and even acceptable behaviour. Combat sports such as martial arts often involve strangulation and is also seen as normal behaviour. 50% of people who experience strangulation will not have any visible signs or injuries. The consequences of strangulation are also not always immediate. They can develop weeks or months later. So assessment and follow-up by nurses is really important. As nurses, knowing how to screen for strangulation and assessing for strangulation can save a person's life. Nurses sometimes ask about strangulation in a situation where there is family violence. They don't usually ask about strangulation in a sexual relationship. They don't ask about strangulation in combat sports such as martial arts. But the consequences are the same though. It doesn't matter how that strangulation is occurring. The consequences of strangulation are not always immediate. They can develop weeks or months later. So assessment and follow-up by nurses or health workers is so important. Knowing how to screen for strangulation and actually screening can save a person's life. Nurses have a really important part to play now and into the future in reducing violence and health consequences.
Kia ora, thank you.
Thank you.